Over the last 24 hours, we have identified 362 new cases of COVID-19 in the province and completed about 7,200 tests. That puts our current positivity rate at 5%. In addition to these cases from the last 24 hours, I want to advise you of some historical cases that will be added to our website today. Due to a technical issue in our case reporting, they are being added later than usual. As you know, Alberta started utilizing point-of-care or rapid COVID-19 tests last month. These are being used in targeted settings where they can help people who have symptoms get tested very quickly. Due to an internal technical issue with reporting of these rapid test results, between December 7th and January 13th, some of the results of these tests were not included in the numbers that we report online. This was an unfortunate error, and we have put processes in place to make sure it does not happen again. We have also added these cases to our online dashboard today. This means that 409 cases have now been added to various days over that 5-week period. It's important to note that this issue impacted our online reporting only. Each of these patients still received their results and isolated during this time, so this did not impact the spread in our province. Also, the change in cases was spread over a long time period, so it would not have impacted any policy decisions. I am mentioning it today because it is important to me that we are fully transparent about the case data that we report. Turning to schools, there are currently 259 schools on active alerts and 9 on outbreak. This represents about 11% of the schools in the province. These schools have a combined total of 500 cases. So far, in-school transmission has been reported to 51 schools, with 39 having only 1 new case as a result. Overall in the province, there are now 637 people in hospital, including 113 who have been admitted to the ICU. Sadly, 25 new deaths have been reported to us in the last 24 hours. These Albertans were between the ages of 41 and 100. My deepest sympathies go to the family, friends, and communities mourning the deaths of these individuals. They loved and were loved and will be missed. As we work to advise on the best path forward to prevent hospitalizations and deaths from COVID-19, as I mentioned earlier, we are closely monitoring for the UK and South African variants here in the province and are watching spread that is happening in other jurisdictions. My team and I are also keeping up with the latest research and developments from across the country and around the world. If additional steps are required to prevent the spread of variants in Alberta, we will take action to do so. Finally, I want to thank the many, many Albertans who continue to follow the public health orders in place. You are the majority, and you are the reason we continue to see promising progress in our daily case numbers, positivity rate, and R-value. Your sacrifices and selfless efforts are making a difference. Through these efforts, our hospitalizations have also declined, but unfortunately they remain very high. This is because hospitalization rates are a lagging indicator, and on average, patients admitted due to COVID-19 have an average stay of 12 days. This can be even longer for the sickest patients who need ICU care. Until our hospitalization rates come down like our other numbers, we need to continue with the measures in place. I know this isn't easy, especially for those whose businesses and work have been impacted, but it's necessary given the continued strain on our healthcare system. That strain has also come with its own hardship and consequences for the many Albertans waiting for scheduled procedures and surgeries. As soon as it's safe to recommend the easing of any restrictions, we will do so. Until then, we need to continue to follow all the measures in place. We know that schools, like any other institution, they are vulnerable to community spread, and of course with the concern about the variant, we're watching that very closely to determine if there may be any extra steps that are necessary. At the moment, with respect to the schools that I'm aware of that have operationally needed to shift to remote learning format temporarily, What we do know is that the measures that we have in place with respect to the formal environments, the in-classroom environments, that those measures do mitigate spread. We also know that when people in times outside of those formal environments, so at break times, lunch times, after school, when they don't follow distancing, when they don't follow continuous mask use, that raises the risk of transmission significantly. And so while schools are currently in open state in person, because there is great benefit to our students and to our society for having our students be able to participate in that in-person learning, it's a reminder to all of us, whether it's schools or any other setting where people are attending in person, that there is no time when we can let our guard down. It doesn't matter if it's lunchtime, break time, after school or after work. Any time that people are together in close contact without using precautions, not wearing masks, and again in a closed environment, the spread of the virus can happen, and that certainly is what we're seeing in some locations.
First of all, we have not made any distinction about essential versus non-essential with these measures that were announced in November and December. So just first of all, to clarify that. And I actually think that in the spring, when we made that distinction, like other jurisdictions did throughout the world when they imposed their measures in the spring, I think that was a mistake in making distinctions between essential and non-essential. What we've done with these measures and what we're going to be doing going forward as we ease restrictions, like we did, I guess it was a week and a half ago, related to personal services, is about risk. And so all of these activities, including activities that happen within a business, all have different levels of risk. And what we have to do as a government is assess the various levels of risk that these activities might pose to the community and easing restrictions depending on our hospitalizations and other metrics. And we'll continue to do that, continue to look at our hospitalizations because that's our focus. We've said as a province, we're not chasing zero with our cases, but our focus with the November and December measures was to deal with the pressures on our healthcare system, to make sure that people who are critically ill continue to get the care that they need, people can continue to get the surgeries that they need, and that was our focus. Now, depending on our hospitalizations, what will we be able to ease for the various activities depending on the risk? And that's what we're going to be doing in the coming days. As I said earlier in my announcement today, is that we hope to make some announcements going forward. We understand that a lot of businesses have anxieties, and our hearts go out to all businesses who are affected by these health measures. There are many businesses as well who may not even be directly affected by the health measures, but indirectly because the economy is affected. We understand that. And we understand that the balance of the restrictions against the social and the economic consequences of them. But our focus is going to be on a risk-based approach, not essential versus essential. And we're going to continue to work with those industries, including with the restaurants and hearing from Restaurants Canada, to be able to come up with a go-forward plan for those businesses and how we can move forward in easing restrictions and how people can better understand how and when those restrictions would be eased.